Hello, and welcome to another episode of LSVT Global's podcast, Think Big and Loud, where we share inspiring stories, expert insights, and engaging conversations, all designed to empower and uplift those living with neurological conditions and those who love and support them. My name is Beth Peterson, and I'll be your host for the show today. And today's episode features Dr. Lou Jensen, and you may recognize her from a recent feature we just did on her and her department at Creighton University. Dr. Jensen is an associate professor in the occupational therapy department at Creighton University, and she's also the associate vice provost for the Center for Faculty Excellence at Creighton. And she kindly accepted our invitation today to discuss how she pioneered an online LSVT BIG training and certification experience for her students beginning in 2016. And over these past 8 years, her program has helped prepare around 400 occupational therapy and physical therapy students to deliver LSVT BIG. I'm very excited to talk with her today about how she developed and has evolved this experience for her program. So Dr. Jensen, welcome to the show.
Thank you, Beth. I'm so excited to be here, and please call me Lou.
Okay. So I know I gave a brief introduction to you, but do you mind expanding on that a little and telling us a little bit about yourself, maybe your educational background, professional background, and where you work and live?
Sure. Well, I was raised in the small town of Sydney, Iowa. Shout out to Sydney, about 1,000 people in Southwest Iowa. I went to St. Ambrose University in Davenport, Iowa, where I earned my bachelor's degree in occupational therapy and psychology. And let's see, one of my level 2 fieldworks for my OT program was, at the time, it was called the Rehab Institute of Chicago, now known as the Shirley Ryan Ability Lab. But that's where I really kind of fell in love and developed a passion for working with people with neurologic conditions. For the first about decade of my career, I was an occupational therapist for a large health system in Greensboro, North Carolina, and really got to delve into inpatient rehab, acute care, working with those neuro patients even more. And then my family and I moved back to the Omaha area after our first daughter was born. And I started working at Creighton University mostly in a clinical capacity, but through the years have become more full-time on the academic side. And I get to teach what I love, which is coursework related to neuroanatomy, neurorehabilitation, and things like that.
Yeah. Well, that's great. Well, thanks for sharing that. Sorry, I think I interrupted you. Were you going to continue?
All good.
Okay. Well, so I know you were originally certified in LSVT BIG back in 2011. And can you remember what motivated you to become certified at that time?
I remember exactly. I was at a continuing education course in Ames, Iowa. And it wasn't an LSVT BIG course. It was related to neuro. And the course instructor had a lot of information about LSVT BIG. And I think she was only planning on mentioning it for a short amount of time, but I was that annoying person that kept asking questions.
There's always one.
That was me. I'm like, well, tell me more. I haven't heard about this. What? I mean, I was sold from the beginning. Neuroplasticity, what? Evidence-based, exercise-based, helping people move better. The whole idea of overlearning. The big one that caught me and reeled me in was a focus on really remediating some things. Even with people that have a degenerative disease, there are things that we can make better. And that's always been kind of my philosophy of practice. If you ask your patients what their goals are, and they say, I want to move better, and you're like, okay, let me give you an adaptive device. And, that's not really being client-centered. So that remediation focus was huge. And also for me as an OT, just the parts that the functional incorporation of functional component tasks, hierarchy tasks that are really meaningful to patients drew me in. So by that time I was teaching at Creighton, not in clinical practice, but I right away tried to find a training and certification course and started exposing students to it as much as I could, bits and pieces.
Yeah. So that was in 2011, and you were kind of trying to employ it a little bit clinically. Is that right?
Yeah, so I
Okay.
was teaching full time, so I wasn't
Okay.
doing a ton of clinical practice.
Mm-hmm.
But when we would have volunteers in, or when I would go out into the community to clinical settings and take students out,
Yeah.
I was talking about it and incorporating components. And actually, too, because Creighton is a doctoral program, I have mentored a few capstone students for their doctoral capstones where they have incorporated this. So I've gotten to work side by side with
Oh, neat.
capstone students when they've worked with patients using the protocol.
Oh, that's great.
Yeah.
So then if we go ahead a few years, I think it's 2015, and you were assistant professor in Creighton's occupational therapy department.
Yeah.
And then how did you learn about the opportunity for your students to become LSVT BIG certified, and what led you to say yes to that opportunity?
Oh my gosh. Well, I remember this. You have a long day and you're coming back and you have emails to go through. And you're sorting them like, I got to deal with this one now, delete this spam, file this one away. I had an email from Laura Gousset from LSVT Global. And one of the really great things that I think about this certification is the listing of certified practitioners. So patients can right away find in their area who can help them with what they're dealing with. And so Laura had noticed that I was, in the registry and affiliated with Creighton University. And I think just she's an innovator and a pioneer herself.
Yeah.
So she was asked if I'd be interested in offering this up to her students.
Yeah. And you said yes.
I said yes.
That's great. Yeah.
We're always looking. Our students are, they come in with dreams and goals and passions, and they're wanting to just do more. And any opportunity to work with real clients or patients is sought after. So we're trying to innovate and offer those additional learning opportunities. And I also thought it was so valuable to offer this because LSVT BIG is one of the few certifications out there that students can get and then be able to implement when they're still a student under the supervision of a certified practitioner. And so being able to provide that for students, then they could go on their field work, or again, because we're a doctoral program, it opened up so many doors for students wanting to explore this on capstone. That final component of their doctoral degree.
Yeah, that's a great point. Yeah. Well, and I think Creighton was one of the very first universities that did kind of employ this learning model for their students in 2016 when you first did it. So do you remember what that first experience was like for you and your students?
I do. That 2016, Beth, sounds like so long ago. Actually, the lab that we were in, and I'll tell you what the setup looked like, but it was in a building that we no longer are in, and it's about to be demolished on campus. That's how long ago that was. For Creighton alumni, it's the Boyne building. We're not in there anymore, but that's where we gathered. I remember Laura and I had just a lot of collaboration, a lot of meeting time for planning. And we got students signed up. She shipped all the workbooks and things that were given at the time to me. I distributed them. And the first time we offered this, we had students actually come in. We don't have required classes on Friday, so I picked a Friday, and students who opted to do this came in, and we spent all day together. And I pulled up the training modules on the big screen to show those, and we could watch those all together. But because with the training and certification, you have to take the little quizzes for the benchmarks as you go through the modules, right? Students had their own laptops logged into their own accounts on mute playing those same videos. Okay. And then when it was quiz time, they would do that. And then when it was time to practice the maximal daily exercises and all of the components of a session, we were able to do that together. I think we took a lunch break, and then the fun began. We arranged to bring in volunteers with Parkinson's disease and their family members. I reached out to alumni or people in the area to come in and just have extra hands, certified practitioners on board to help the student groups. And we practiced things with the volunteers that joined us that day, and then had some chance to debrief. And it was a long day, but it was such a great day, and students were really energized to be a part. And then I think they finished the remaining modules, took their exam and those components on their own after we gathered that day.
Okay. Yeah, that's great. Well, and that was innovative of you to bring in, local volunteers with Parkinson's too, to really make that community involved and give your students that hands-on experience. That was really neat.
Yeah.
To think like that.
Yeah. We actually, as I'm remembering too, our program at Creighton, we have 4 cohorts of students. At the time we had 3, and so we had our Omaha-based students here with me at Creighton, but we also have hybrid students in our Doctor of Occupational Therapy program, located up in Anchorage, Alaska, and then at the time in Denver, Colorado. And so we really stress parity, so that whether you're a student in Anchorage or Omaha or Denver, you're getting the same learning experiences and options. So we use some of our faculty at those additional locations to get certified and to host their own, like they were smaller events, but just like parallel events at those locations. So we were making things happen all over the U.S.
That's a big day or weekend for you. That's really neat that you were able to employ it across 3 different sites. That's great. Yeah. And I like that idea of giving everyone the same learning experience no matter where they're located too. So it's you thought through how to make that happen for everybody. Right. So really nice. I'm impressed that was all on the first time. So that's really neat to hear.
And then again, Laura was a big help. It was a lot of thinking things through, but she was a good partner to kind of make this happen to start with.
Yeah, we'll give Laura some kudos. She is good at that.
Please do.
Logistic planning. Good. And then I know since that first one, you have kind of employed different learning models. I know sometimes they took the full course online individual, and then I know there was a virtual lab during the COVID pandemic. And then I think there was a virtual live learning experience. And then that model you mentioned with online learning plus an in-person kind of practicum with local volunteers. So I guess what led you to your decision to offer different types of learning experiences?
Oh, yeah. We did do a lot of different methods. So I think that first time we really wanted to make sure that we held students accountable and that they had the support that they needed to feel like they were really learning and able to do this. And I think after going through that first time where we watched all of the sessions together, a couple of things. We realized that one, the videos, the training videos for the online training, they're so well done and engaging that really students they didn't have a lot of questions because those videos were so great. And then secondly, there was no worry of students not watching or completing things because they were so excited about this, and to get to the exam you got to do the work, right?
Yeah, that's right. Yeah.
And so I think just to be a little bit more efficient and maybe mindful of people's schedules, we had students watch the training videos up to a certain point on their own before gathering live, just to work with the volunteers that came in again. So it was just kind of a way to be more efficient with our time together and really focus on that time with our volunteers. And then I think, as you mentioned, COVID kind of forced innovation, and LSVT Global was on the cusp of that with doing the virtual live sessions. And so we fit right into that model. And then again, because we do have so many students in so many different time zones and locations, and PT and OT students now involved to offer just good flexibility, but also good learning. We've kind of, went to the kind of mix of online and live. And the cool thing is the outcomes have been the same, regardless of how we've done that. So.
Yeah. Well, that's great to hear. And just for anyone in our audience who might not be familiar with the virtual live, so that learning model is where individuals take some of the sessions, the modules online independently, and then some of the sessions are led by a faculty instructor. So some of that is, on Zoom, where you're in a virtual classroom. So just to expand on what that looks like a little bit. And then a cool development I wanted to ask you about. I know when you first started, it was only for your occupational therapy students, but then I think it was in 2019, you expanded to include physical therapy students too. So has that afforded any interprofessional learning opportunities for your students?
Yes, it was awesome.
Yeah.
First of all, for me personally, I got another opportunity to collaborate with one of my favorite PT faculty members at Creighton, Heather Knight.
Okay.
And she and I were already collaborating on a few other things. We both teach neuro, and we also both were coordinators of our respective residency or fellowship programs. So at Creighton, we have an OT fellowship programs with a specialty in neurology, and then PT has a similar program for they call them residencies.
Okay.
So we actually were able to pull in the neuro resident and fellow and post professional learners to help us organize this event. It was an opportunity for them to learn something new and be trained and certified as well. But they're licensed practitioners, so they were a great help when we had our live days. And then we made the training and certification when we brought the OT and PT students together and offered that to both of them. We made it an opportunity for them to earn some credit in addition to getting their training and certification.
Yeah,
So
that helps.
so that's always good, right?
Yes.
So at Creighton, all of our health sciences students, from OT to PT to medicine, nursing, et cetera, they all have to take kind of an introductory IPE course, and then throughout their time before they graduate, they have to earn 3 interprofessional passport stamps. It's not a real passport. It would be very cool if it was. 3 interprofessional activities, and some of those activities are built into their curricula already, like as required components of required courses. But then we also have the option for some optional activities that students can select from. And so we went through the work of getting this as an approved passport activity. And so students could do the training and certification. And then we just added an element of a reflection, a kind of a debriefing session with them. And that was gold. It was really great to learn about each other's professions and really see some of the similarities, but how we might be different in our overall goals and things with this approach. So that only enhanced the program that we offered. It was awesome.
So then once that kind of got that passport activity approved, then you can continue to do that as you move forward.
Yes. So annually when we do this, it's an approved activity, and, it becomes kind of word of mouth legend, like, oh, if you want to do a really great thing, do this.
That's right. You're a legend on campus. I love it.
That's right.
Yeah. Well, this might tie into it a little bit, but what do you think has been the best thing, or something your students might have said has been the best thing about getting LSVT BIG certified as a student?
Okay, this is fun. I asked them
on
social media. So can I read you a few things?
Yes, I would love it.
The call out. And so thank you to those of you who replied to me. But okay, let's see. Here, I'll keep things anonymous. But one student who works in like a skilled nursing facility, transitional care unit, assisted living, long-term care. She said, a graduate now, right? She said, having the opportunity to do this as a student really gave me some confidence to jump right in and be hands-on, even with some pretty complex patients when I started in the nursing home setting. I feel like a lot of times patients with Parkinson's, especially when it's very advanced, can be intimidating to clinicians. And I felt like this certification and training gave me the skills to not feel intimidated.
Wow.
So that's cool. Let me read you another one. This is a really recent grad who just graduated in May.
Okay.
And he says he had the opportunity to engage in the BIG program on a level 2 field work with many clients with Parkinson's disease. And he had all of these ways that he graded things for the level of the client, which was so cool. And that it just helped him feel a lot more comfortable to jump right into his fieldwork experience, having these skills. And the final thing I thought was cute. He said, sure was a workout, though.
It is. I know.
He did it a lot. And let's see, I'm going to give you one more because this is kind of a different aspect that I thought was neat. Someone years ago said, I was trained as a student and was able to use it on the capstone experience. One of the students' objectives was to go out and discuss it with neurologists and get referrals. And so, before he even graduated with his degree, he was, talking to physicians and marketing and talking about the evidence and benefits of this. Yeah. And I think that's important to point out, that this certification and training isn't just the hands-on part, but it's kind of the whole picture. And that really helped him as a student. And then the cool thing too, I could talk all day. I won't read them all.
That's why we're here. Yeah.
Even students who didn't pursue the certification while they were a student, maybe did after, or just getting some exposure, by me talking about it and being pretty passionate about evidence-based practice, it helped them once they graduated. So another student or graduate said, I wasn't trained as a student, but you inspired me to go get training later on. And so I was really grateful for the exposure. It's been an amazing tool and toolbox. Another one said, this is an alumni from a long time ago, before 2011, I think. We didn't have the certification option, but I appreciated getting to learn about it and have exposure. Because of that, I was able to talk to my boss at the time when I graduated, and we ended up bringing it to our facility. And then another student just said, just kind of the focus on getting some specialty skills helped him. He's a business owner now. And so he really supports that and finds that professional development really valuable.
Yeah.
There you go.
Well, that was great. I mean, that was a brilliant answer. Well, it's neat to hear. So it gave them confidence, it seems like, to be able to jump right in. But I also love that idea where your students really kind of had some of these kind of thinking outside the box experiences, where maybe if they hadn't been exposed to that, wouldn't necessarily, feel the need or be comfortable going to talk to neurologists or talking to an admin to see how we can get this in the department. So it's neat that also seems to have helped them with their thinking, just, okay, let's see how I can bring it. And maybe they wouldn't have thought about that before. So it's neat to see that kind of all around, gave them confidence, but also just different ideas of what they can do. So thank you. That's a really nice, robust answer to that question.
I want to, I'll email you if I get more that keep coming in. It's been really fun to check my social media lately.
Yeah. Well, thanks for sharing those.
Sure.
And then I was just going to ask, I know yours really has been a model program, and I'm sure Laura has expressed that to you under your leadership. And you mentioned a couple other colleagues, or you mentioned Dr. Becky Kinnison and Dr. Heather Knight, so your PT and OT colleagues. Yes. And so with all of you leading the way, I know Creighton has offered the LSVT BIG training and certification to, I think, around 400 students. So what advice do you have for other programs or faculty who may be considering bringing LSVT BIG to their community and offering it to their PT or OT students?
Yeah. Okay. Well, have I mentioned how great Laura was? And through the years, all of the support from LSVT Global has just been really great. Like guidance and ideas and suggestions, but also willingness to listen to our context and culture and what's going to work best, and kind of go along on the journey with us. But I think that advice for the programs is just know, if you're thinking at all about it, like reach out and have a conversation to see how LSVT Global might be a partner for you, because we found them to be really amazing partners. Other advice is that students really love this, and not every student opts to do this. But even if they're kind of discerning what area of practice they want to go into, and they'll ask me about it, what I tell them is, so much of what they'll learn can be applied to other populations as well, in terms of the research on neuroplasticity and overlearning all the components, right? So even if they decide to, work in a different area, it will be a win-win and really good education for them to help them go. Also, it's one of the few certifications, as mentioned, that students can get while students, and it honestly has given them a marketing edge. I was talking to a hiring manager at a hospital years ago when I first started this, and she was like, "Oh my gosh, you're the one that brought the training in?" Because I'll tell you, like when I had candidates and seeing that they were already certified and can get this program lifted off the ground, with some mentorship, that was a good selling point. So it's good for students while they're students and when they graduate. And the other thing that I would say that I think students really like about this, especially those interested in neuro, who get really tired of us saying, well, it depends, or it's kind of a gray area sometimes with working with the neuro population. So let's face it, who doesn't love a good protocol? And because because it's a protocol, I think it gives students the confidence up front. And then I kind of liken it to, like, if you're a parent who sneaks the green vegetables into the macaroni and cheese, it's a protocol, yes, but it's got the room for being really individualized and for flexibility and adapting it to your patient, and a lot of creativity with how you engage your patients in those functional tasks. So students love that. I think another piece of advice is, if you decide to take the plunge and do this, like, collaborate with others. You know, PT and OT collaboration makes good sense if you have both programs at your college or university. Collaborate with your community partners. That's how we got our volunteers in. We've reached out local support groups and hospitals that we collaborate with. One of the really cool things we did a couple years in was, students are always looking for leadership opportunities, and we happen to have an interprofessional student organization for students interested in neuro. It's the Neurorehabilitation Organization. So we brought them into the mix, and they helped with the planning. They helped with educating and greeting patients or volunteers that came in, and with recruiting the volunteers. A lot of their family members sometimes would come in. So it was a really great leadership opportunity. So involve as many other people as you can. You don't have to do it alone. Bring in your university communications. We called the news channel, and they were going to come, but then there was like tornado warnings in a different part, so the news stations weren't there. But our UCOM people were taking pictures, and it's great for that, right? Because it's very active, and you've got real clients and volunteers coming in. And then the last thing I'll say is, I was always kind of stressed about making sure I had enough volunteers coming in and, taking good care of them when they came. And one year we did have a couple that had to cancel last minute because of life comes up.
Yeah.
And so we do a lot of simulation experiences in our simulation lab here at Creighton. And that they often involve standardized patients where you train actors to portray a patient. And so I wanted to, we had real volunteers coming in with Parkinson's disease, but I wanted to have a few extras so we could have smaller student groups. So I called my parents, who were in their early 70s at the time, and they brought some friends, and I trained them and made it very respectful of everyone that was there. But they were awesome. And I will never forget looking over, I think my dad had said that he wanted to be able to participate in all the active activities with his family on vacations as one of his goals. And he was finding it harder to do that, which was true. And so when I looked over at one point, students had a makeshift stand-up paddleboard with makeshift oars, and my dad was on there doing stand-up paddleboarding.
Oh, I love it.
And it was so cool. And, he was having a great time.
Yeah.
Students were having a great time. And the truth of it is, it really benefited my parents and their friends. They didn't necessarily have hypokinesia or, small movements, but they did have balance, and, it was a good balance work activity. It was a good kind of aerobic exercise for them, and a lot of fun for the students too.
Yeah. Well, that's amazing. It sounds like you've done a great job. I love that idea of, you don't have to do it on your own, and you've done such a great job of building a whole community around it, whether it's your students and supporting faculty or the outside community. And it just seems like such a good time. Like, you've really built an incredible program. So thanks for sharing that model. And I love what you said in the beginning, like, even just having the conversation, and you're someone, as we've heard in the interview, that you've had, multiple kind of different ways to do the training. So, if there's a certain university that doesn't think it can fit a certain model, those conversations can lead them to what can feel good at their university. And then like you've done, just bring in as many people as you can to support it. And it sounds like it's, beneficial to everybody all around. So that's great. Another
Absolutely.
really neat response to that question. So thank you.
You bet. I was thinking too, even before I uh, partnered with LSVT Global, and we started offering this to students. Just like any good OT or PT educator, you bring in your own passions and things from your clinical practice and what you know about good evidence-based intervention into your classroom. And so, as I learned from students when I reached out recently, even having a little bit of exposure to that, if you don't offer the certification, might lead them to just being knowledgeable about it. And just some ways I incorporate this in the very first semester when I teach neuroanatomy. Basal ganglia can be a little boring until you start to apply it to, Parkinson's disease. Does anybody know
Yeah.
someone with Parkinson's, and make it applicable? And, if you're sitting in an hour and a half neuroanatomy lecture, what better way to break that up a little than to stand up and like walk big around the classroom? So that can lighten the mood. It can give them a taste of and a little exposure to something, even without the full certification.
Yeah.
Then when I, teach my neuro rehab class 2 semesters later in our students' 3rd semester here, I give them even a little more exposure, whether they opt to go on and get trained or not. And it's really awesome. Students have such a great holistic view of what occupational therapy is, or what therapy is, that I think sometimes it's hard for some practitioners to come up with functional component and hierarchy tasks, but it's not for students, because they get the broad view of what is occupation, what is function. And so just the brainstorming and some of the things that we do just as little lab activities, honestly, like, inspires me and gives me ideas.
Yeah.
So students are really wise in some ways. So
Yeah, no, I agree. And I love, they have great wisdom. And then also I loved when you were talking about their leadership too, like giving them some of the responsibility to put things together too, so they can really own what they're doing. So that's great.
Yeah.
Well, and then my final question for you is just, what advice or words of encouragement do you have for PT or OT students who are looking into their future careers, not really knowing what may come? And this doesn't have to be just LSVT BIG related, but just any general advice that you want to share.
Oh gosh. Well, so first I would just say, be so proud that you have chosen a profession of service. Like, there's nothing more sacred than being able to meet a fellow human being that wants to work on, living life to their fullest, right? So I love the idea that physical therapy, occupational therapy, it's a calling or a vocation. And my favorite definition or quote about vocation is, it's where your greatest joy meets the world's greatest need. And I think that there are so many people out there that need us and need us to be on our game, need us to be caring and passionate. And students have that in spades. It's why they chose the professions they wanted to go into. So be proud of that. And other advice would be, always kind of keep that why in mind. It shouldn't be easy to become an OT or a PT. We have an important job to do. And so the journey can be long, and sometimes it's hard to, keep the end in sight. But I guess my advice is to do that and relish any opportunities you have along the way to remind yourself of your why. And often that is engaging with volunteers or with patients or clients, and letting them remind you of why you chose your profession. Even if you don't know where you're going, if you want to be in peds, but maybe I'll do this LSVT BIG training, I don't know. Having those moments where you get to connect with real people that are dealing with real issues kind of helps remind you of your joy and your why. So that's my advice.
That's perfect. I love it. So be proud of what you've done and are doing, and then remember your why. I think that's perfect advice. So thank you.
You bet.
Well, I'll go ahead and wrap up, and I just want to do some final credits. So a big thank you to you, so Dr. Lou Jensen at Creighton University, for giving us your time and wonderful words of wisdom. And then I also want to credit the theme song that you're hearing during the podcast, and that's called Think Loud for Parkinson's by Kindred Spirit and Leo Sayer. It's a new song and video that were inspired by LSVT Loud speech treatment. It was developed to raise awareness for Parkinson's worldwide, and it is available for purchase on iTunes and Amazon, with proceeds being split between UK charity called Cure Parkinson's, and the Parkinson's Foundation in the US. I also want to thank our production team who does all the behind the scenes work to glam up the podcast. That's CS Design Studios. And if you're interested in learning more about LSVT Loud Speech Therapy or LSVT BIG Physical or Occupational Therapy, or if you want to locate therapists in your area, visit our website at www.lsvtglobal.com. And then this journey for us into podcasting is still relatively new. So we would love as many subscribers as we can get so you can come along with us and see anytime an episode drops. So go ahead and click your subscribe button wherever you get your podcasts. And so you can join us for future podcasts as well. And so I'll say goodbye for now, but we look forward to thinking big and loud with you again on a future episode. All right. Thank you. Bye.
Yeah, yeah.